This is Sky News Sunrise with Eamon Holmes.
Celebrities and doctors are launching a new campaign to raise awareness of a highly effective but rarely used treatment for cancer. It involves lasers to activate a drug inside a tumour which then destroys the cancer cells, but it leaves healthy tissue untouched. Our health correspondent Thomas Moore was given exclusive access to one of the first treatments for pancreatic cancer.
Only with the lights dimmed can John Switters safely have this experimental cancer drug. It's totally harmless in the dark, but it's lethal when it's activated by a laser beam deep inside his body. If all goes well, it'll destroy the tumour in his pancreas, but leave surrounding healthy tissue untouched.
Because of the way the tumour grows and the number of large blood vessels, the tumour tends to wrap itself around them, so surgery is not very often an option. But if they can shrink the tumour enough, then surgery does sometimes come back as an option after that.
The laser beam is fired down a probe precisely placed inside his tumour. Just 40 seconds of light is enough. It's called photodynamic therapy, or PDT, and doctors at University College Hospital in London are conducting the first trials in pancreatic cancer, a disease that currently has a survival rate of just 3%.
It's a cancer which affects more than 7,000 men and women per year in the UK. We've had no effective treatments for really more than 20 or 30 years. So we all feel that it's urgent, patients and the public and doctors alike, to really try and bring in new treatments which are going to have effect in this disease.
But the trials cost money, and now the charity Killing Cancer has launched a new campaign to raise £50 million to fund research and finally prove that PDT works. PDT is already proving highly effective in other cancers. Of 27 patients treated here for terminal lung cancer, all but one are alive and well, and yet the treatment is rarely used on the NHS. Just 1% of suitable cancer patients get the treatment, largely because doctors have been slow to recognise its benefits. Celebrities, including football manager Sir Alex Ferguson, have joined the campaign to raise awareness of PDT. He lost both his parents to cancer.
I wish PDT had been there 30 odd years ago, and I gave my mother and father a chance and a choice to avoid what they went through,
The Department of Health said it's currently looking into PDT and is committed to rolling out new treatments where there's evidence they work. But for campaigners, it's taking too long. They say patients' lives are at stake. Thomas Moore, Sky News.
Now, if you'd like to find out more about PDT, photodynamic therapy, and the campaign to make it more widely available on the NHS, there is a website, www.killingcancer.co.uk. We want to talk more about this now, and there you see throat cancer surgeon Colin Hopper and David Longman, and he's from the charity Killing Cancer. They both join me from our Central London studio. Gentlemen, good morning to you. Colin Hopper, first of all, why is it, do you believe, that we don't see more of this treatment?
I think the problem is that we've not been very good at generating the right evidence, the right level of evidence in prospective randomised studies. That's the simple answer. We haven't got enough evidence to convince hospitals that it's effective and cost effective. That's part of the problem. There is a general conservatism about new treatments being adopted, and some of the treatments are seen as new costs because the drug costs in this situation are about €7,000 a vial of drug, and that's seen as an additional cost. If you actually work it out, PDT is cheaper than extensive surgery or some of the other treatment options that are available.
Yeah, if it works. I mean, at this stage, as a surgeon, do you need convincing that it works?
Well, I've done about 1,200 treatments over the last 10, 15 years. Most of the patients I get to treat are those that everyone else has given up on, so they've got advanced head and neck cancer, maybe tongue-based tumours where they've failed primary treatment with chemoradiotherapy. So they're a tough group to treat. Any treatment they have is going to be fraught with difficulties, and the survival rates are pretty low. But with PDT, we've been producing some impressive results, which we've published in reputable journals, so the information's out there, but it doesn't quite come up to the gold standard of prospective randomised studies, which is what everyone wants to look at.
Okay, David Longman, how far are we away from the evidence being there, from tests being produced that say this is conclusive?
I don't think we're far away at all, but I think more to the point, we're looking at a groundswell of opinion, of change. The NHS is designed and is there to treat patients, to give them the treatment that they want and that they need. And I know full well that, having watched my own father die from head and neck cancer, from major surgery which disfigured him and destroyed him, the work that people like Colin Hopper can do undoubtedly is a preferable way of living or dying.
Yeah, but the thing is, okay, you believe it saves lives, but you have got to show that it saves money, I suppose, haven't you?
Yes, we've produced studies ourselves as the charity Killing Cancer, but more studies are needed, such as the one with pancreatic cancer, which we've started to fund. It's only through doing more of this work that we'll actually get the evidence that everybody needs. But one thing you can't question is that PDT is cheaper and it produces a better result for the patient.
Okay, Colin Hopper, again from the surgeon's point of view, could you just explain, if someone is suffering from cancer, the advantage in this treatment? Obviously, you know, if it saves your life, that's the main advantage, but as I understand it, this reduces the need for chemotherapy or radiotherapy and all the awfulness that goes with those treatments.
Yeah, I wouldn't want to suggest this is an alternative. This is another therapy. We need all the therapies we can get in head and neck cancer, for example. But PDT is a localised, targeted treatment that spares blood vessels and nerves, so that if you treat, for example, a tongue cancer, the tongue will continue to function normally, so speech and swallowing's not affected. And it does allow us to treat non-cancer conditions, such as big congenital malformations in the head and neck. Because it spares nerves, it preserves function, and therefore, because it's carried out quite quickly, it's a very effective treatment that doesn't mean patients stay in hospital for long periods of time. So, function's better, hospital stays are shorter, and as long as we can prove that we have equal efficacy, then it's a very useful addition to our armamentarium.
And David Longman, just finally, is PDF a term that is going to come into our vocabulary when it comes to talking about cancer in the near future?
I believe that PDT certainly is, and what I challenge is Professor Mike Richards, who's the Cancer Tsar, the Director of Cancer Services. Please, you've met with all of the great people who are doing PDT now. We need that clear statement from you that you and the Department of Health are backing PDT, because there are patients right now who are watching this programme who are about to go to hospital, and they're suddenly going to say to themselves, hang on, you mean PDT could be available to me? Why am I not going to get PDT today? Why am I going to get that surgery or that chemotherapy? We have to work now, and most importantly, we have to raise those funds to pay for the trials. But Mike Richards, the pleasure's there. Please make that statement.
Gentlemen, thank you both very much indeed for your time this morning. Good luck in your work. Thank you very much.